Okay, we have some technical problems. Here we go. Here we go. You got it? No. So if this happens again, you know what to do, right? Yeah. Okay. Yeah. Okay. Okay. So people have been asking for the notes for the presentation. Put it down. I'm going to circle this around. Put your name and email here, and we'll send it. And we'll have it sent to you. Okay. All right. It's out on Amazon. Yeah. Yeah. So talk to Amazon, exactly. Talk to Google and Amazon. So basically, listen, what we're going to do now is who was here just before break? Okay. Who's here and wasn't here just before break? That's okay. Okay. Who was here and is not here now? Okay. Okay. So I'll tell you a couple more things, and then I really want us to just pair up and practice, okay? Practice the bleeding. At least that you can get down today, because it's just the first part of this whole system. But for some cases when there's a lot of blood stasis involved, it actually does most of the trick. Okay, so this is why I would suggest that we practice this and you work with that. Bleeding Jigma points is actually really a strong technique, right? And of course, like I said, if you want to learn the whole thing, we're going to do a practical 2-day course in 6 weeks in November. It's City College of Acupuncture in London, and all these disorders, both neurological and musculoskeletal, you can treat with this. And it's seriously, I've been teaching this class for more than 10 years, and it never ceases to amaze us. I was teaching in Holland last weekend, and we had come on in, welcome. We had one of the practitioners actually brought one of our patients, a very severe patient. Unbelievable story. We have this filmed. This boy, it's not a boy, a 24-year-old guy comes in. He comes in with his mother with a crazy story. Sad story. In college, he fell from a two-story bed. Two-story bed? It's like, bunk bed. But he fell on a coffee table, glass coffee table, okay? So, and he was hit in the back of his head and he lost his consciousness, but his calf muscle was completely cut from the glass, but he was unconscious. So he wakes up, nobody knows how long after, maybe 10, 15 minutes in a pool of blood, and he's bled so much that he can't even speak. He can't shout for anyone. He was just bleeding there, saying that this is my moment, I guess. And luckily someone just passed through and saw him and called an ambulance, and they rushed him to the hospital, and they saved him. They saved his life. And he had a cast for like 6 months, and they told him, like, in about 6 months maybe you can start walking. And he starts to try to walk after 6 months, and he can't walk at all. He comes back to the clinic, and they re-examine him and say, listen, we rushed to save your life, and we connected the blood vessels and the muscles, but we didn't do a good job in connecting your nerves. So you have a very severe nerve damage. And maybe in a year and a half you can start walking or standing on your foot. And so a year and a half passes by, and still not much change almost at all. He comes back to them, and they tell him, listen, this is it. They do an EMG test on him. He has like 70 or 80% reduction in his nerve conduction, and they tell him, listen, you're going to have to live with this. Maybe in 10, 15 years it's going to regenerate and so on. So he comes to us last week. This is 7 years after the accident, okay? He barely walks, can barely press on his leg. He walks with not crutches, a stick, a walking stick, okay? And so part of the things that we do in this before we do this bleeding is that we do an assessment, and we try to be as objective as we can about the limitation. So we tested his range of motion in terms of flexion and extension. So you see the healthy ankle does this, and the compromised one is about this angle. And when he does that, he says he can't sleep because he has like pain and degree of 7 on 1 to 10 every night, burning pain. And he can't do any outer external rotation, no against resistance, absolutely none. So I asked him, listen, what about standing on one foot? And he's like, are you kidding me? So I tell him, try, okay? So he holds his mother and he holds his stick and he's like wobbly, and then he can't do that. And the people were asking, we had physios in the class as well, they were saying, but there's nerve damage there, how can this help? And I'm saying, nerve damage is one part of the trauma. It's the holistic view of what's going on in the tissue. It involves a lot more. It involves adhesions, it involves edema, it involves inflammation, it involves, from a Western perspective. And there's channels there, okay? The channels have been disrupted, and we can reconnect the flow, or reestablish the flow of the channels. And he was asking, do you think we can help? I'm telling him, listen, in these kind of cases with trauma to the tissue, we know that this system normally works really well, and I think you may even see some results even just now, today. So I was very happy. So the damage is really severe there. We had to bleed 3 channels. It was Joannean liver, it was Taiyang spleen, and it was bladder Taiyang. And we bled these 3 channels. And I asked him, okay, why don't you try to do the flexion again? And immediately we see a change, like this is the healthy one, we got like half. He's like, oh, this is really interesting. So we tried to push to the side, and he has more power to the side. He says, listen, the pain was reduced now from just doing like this 7, it's now 2. And then we do the whole treatment, we put in the needles, 25 minutes, and pull the needles out. I ask him to he says, okay, the pain is still a 2, okay, but it's a 2. And he has a lot more power to the side rotation. And I ask him, try to stand on your foot again, okay? So he walks down, and he stands there, and he's holding his mother again. He's standing on the foot, and I tell him, it looks pretty stable. He's not wobbly at all. Tell him, let go of your mother, and he's standing on one foot. And immediately his mom bursts crying, and he starts crying. There's a whole drama, and everybody's like, the wow, we call it the wow effect. And I was saying to people, it's always nice to see this happening, but it's not really a surprise, because when you have this long-term stasis in the channels and you resolve that by bleeding, you should be expecting this really, really profound effect, an immediate effect almost, okay? And the longer the better. We had a lady here 2 years ago with, I think it was 20-year knee injury, okay? Increased range of motion within 20 minutes from I think it was 20 degrees to 45 degrees. And we see this in the clinic all the time. I'll show you in a minute what we do with this in the emergency room in the hospital I used to work with. They did a whole study on that. It works, when there's stasis, it works just like that. And if there's not stasis, there's a more chi stagnation, the needles do the trick. And you should be expecting with channel-based acupuncture immediate results, okay? So this is what we will be doing now. So I want you guys to pair up. And there's gloves here. Where are they? Here. Okay. Gloves, lancets. We're going to give you each 15 minutes, because we still have a lot of lecture to do. And I want you to pair up with your partners. See if there's a limitation. It could be pain. It could be range of motion. It could be numbness. It could be tingling. It could be decreased sensation. Anything. But it's pinpointed on the exact channel. Now, the thing is, you have to be very exact in quantifying the location and the degree of the limitation. Okay, so if Alex here says he has pain in the shoulder, I ask him, where is the pain? He says, I don't really know. So I ask him, okay, push my hand this way. Can't feel it. Pull it that way. Can't feel it. Push my hand to the side. Still doesn't feel it. All right, put your hand this way. Bring it up. He says, I feel it now. Okay, show me where it is. So he points. Okay, and I ask him, okay, so it's right here in this movement, how much from 1 to 10? Okay, so it could be the pain scale, or it can be the range of motion in terms of degrees. Try to really quantify it, and then when it's accurate, you can do that. Are you okay with practicing, or you just want to do theory today? Okay. Yeah? Musculoskeletal, neurological, but not, for instance, some of them too. But then we do more internal work. Channel theory based, same idea, different technique.
What about gyne stuff? About stasis?
Yeah. Yes. But again, gyne, we do channel-based acupuncture, which is internal medicine. This is more channel-based medicine, it's more external. But still, same concepts.
But if someone
Yes.
Inflammation, like long pain, intermediaries, that kind of stuff.
Yeah, you probably do.
Initiate it with bloodletting.
You could initiate it, right? But you need to follow up with your internal. Definitely.
Do it that way.
Yeah.
Can I just, if it's a back problem, I saw you when you were in Nottingham 2 years ago.
Hmm.
Have I remembered correctly that there was a above and below the navel?
Well, exactly. If you're treating problems below the navel, you treat the feet. If you're treating problems above the navel, you treat the hands. So find the channel. Find the channel. Massage it, squeeze it, and then bleed it. Okay, do you want to try? Do you want to give it a go? Okay. Yeah, try it. Make sure you're on the right channel, though. Problems above the navel, hands, trouble below the navel, feet. Thanks for that remark.
If it's a back problem,
Go for the leg. Okay, so we don't have a lot of time. It's 11:40. When are we supposed to be done? 1 o'clock?
Yeah, 1 o'clock.
Okay, 10 minutes each. Just try it. Go ahead.
Here.
Gloves here. Lancet needles are here. Alcohol swab. No, they're the same size. They're all the same, just different colors. Okay, there's cotton ball here.
one glove each.
So one, yeah.
Thank you.
Go ahead.
Find the channel, massage, squeeze. As you squeeze as you're massaging and then bleed.
Yes, exactly. Okay, bleed the jing
Squeeze
well.
out 8.
What's that?
Do you have gloves?
Yeah, they're, where are they?
Oh, they're over there.
Yeah.
After each.
Yes, yeah.
And it's always the nail bed.
The corner of the nail.
I have a lady who has numbness in both of her hands, and I've been doing the tips, but I haven't been
No.
bleeding them, so it's
No.
best to do.
Yeah, but do the jingle point. The only one that I use for a tip is pericardium channel. The other ones are just corner of the nail. Okay?
Do 2 sides at the same time.
Well, you need, if you need,
Depending on the channel.
depending on the channel. Any more lancets? I see this here. Just make sure that you take just one lancet each. Yeah.
How do you distinguish when something happened across 3 channels? I had a quad bike land on the back of my leg, which probably goes across kind of spleen, bladder and kidney channels when I was 17, and there's definite blood
So
stains
normally
there.
we palpate for the worst one, start with that first. You do 2 channels and then another 2 channels.
2 channels. So
You can do 2
palpate,
channels.
2
You can
channels.
bleed and work on 2 channels, yeah.
Okay.
Are we out of lancets? Can you get us more lancets? I think we're out. Bleeding? Yeah, okay.
Is it okay to retreat, or is that enough?
Yeah. No, I would just do needles for her now. I would just do the needles again because it was just 10 minutes because we've already bled. So we'll do LI4, stomach 43, and like a spleen point on the opposite side. They're gonna get us more lancets in a second, okay? Lancets, they're going to get us some more. Do you have, they're going to get us, I just asked for them to get us some more lancets.
We'll wait till the queue.
Yeah, okay. Okay, so listen up, everybody. If you don't have a lancet, okay, if you don't have a lancet needle, and instead of waiting for them, use one of these small. There was a needle box here somewhere. Needle box. Yeah, you can use one of the short needles instead. Okay.
Are there any other ones?
Yeah, just use the needle for the Jingwell point.
Is there any cotton? Are there any long things?
More.
Or is it just tissue? Thank you.
So why don't you use just one glove each, so everybody can get one?
And it's supposed to
Yeah.
shirt on with
Uh-huh.
a collar, I
Yeah.
mean, do we have to take the shirt
No,
off
because you're
and
using
massage
the-
all the way
No, just towards the end of the channel. Make sure you're on the right channel,
over
though.
the shirt?
Yeah.
Okay.
Okay, you can use the needle instead of the lancet. Okay.
When I do that,
Where are the gloves?
What's the technique for putting the needle in?
Really swiftly.
Just
Swiftly. Yeah, and ask him maybe to exhale or to.
Repeat it,
No, just once.
and then you just squeeze it.
Yeah. Let me just say that. Listen, everybody. Here's some questions. You only prick once. Okay, you only prick once, really quickly. You don't repeat it. The counting was the number of drops that I was counting drops of blood. Did everybody get that? You don't want to prick your patients. Okay, just prick once.
if you run out of lancet, say,
Yeah, they're gonna get some, but if you don't have a lancet, use a needle instead. Just leave it there. Okay.
have you got any gloves?
I think some people took 2 gloves.
Whoa. Or you just using
Just use tissue. Okay, make sure that you this doesn't help.
You've got chaos now.
That's okay. It's good. It's good chaos. It's positive chaos. Okay, if you're using a needle, leave it there. If you're using a needle rather than a lancet, put it in and leave it. If you don't have a lancet.
If it's like around gallbladder 21.
So Sandgel point.
Sandgel is
Yeah.
prepared.
These are the shops, right?
Was that? Yeah, you can throw it. Is that? Yeah, cotton ball now. But let's throw it in the bin. Let's look for rubbish. Yeah, 6 or 9. 6 probably. Yes.
Missed the very beginning.
Yep.
We've got something that's on the bladder channel. Do you do
Where?
the
Where's the
dual
pain?
point?
Where's the pain?
It's actually just on the one side of almost the Achilles tendon. When
Yeah.
it's nearest.
So bladder 67
So
on
you
that
wouldn't
side.
do the part, you wouldn't do the small intestine.
No,
or
right now we're just
Okay, thank you.
Does anyone need help? Yeah, 8. Yeah. Be very accurate with your channel selection and bleeding. So again, if you're not using a lancet needle, just use a regular acupuncture needle and leave it there. Leave the needle there if you're not using a lancet. Yeah. Just if you're using a needle instead, an acupuncture needle, leave it. Yeah, leave it.
I've massaged down the Sandgel channel.
Yeah, so
but
basically
it's
I
about
would-
here really that
It's still Sandgel. It's gallbladder Sandgel. So it's the same channel, remember?
So like that. Oh,
All the
I
way
see.
down.
Okay, like that.
Yeah.
And the Sandgel one is on the
So
lateral
it's
side of.
here,
Okay.
right here.
Okay.
Okay. Yep.
Sorry, I'm not very good at
So which channel are you bleeding?
stomach.
Stomach for what pain? Some pain. Yeah, excellent. Excellent. Did you quantify it? Do you know how much restriction he has?
Yeah,
Does
for,
this- Did you-
difficult because he's actually got quite a lot
Can you-
of
can you-
movement, but yeah,
Well,
exactly.
that's it. So, like this.
That's there. Okay, excellent. So you
Yeah.
see, you can see that. Okay. So stand back up again. Okay, put your foot up here. Okay, massage down the stomach channel.
Yeah,
All the way down here,
Yeah.
and then the point is right.
that's right, but I
Here.
couldn't get it to bleed.
Okay.
Oh, you
so,
did. It's bleeding.
Yeah, it's bleeding.
It's
So you
bleeding.
can use some more alcohol as well.
Yeah.
Okay, so yeah.
So that was
But
one.
where's the needle?
Yeah.
Let's leave the needle there for a second. We're just going to put it in here. Okay. And try to see if there's any difference with the needle there. Yeah, just be.
Still painful.
You think?
To go down it, you weren't quite sure regardless.
Leave it there for a couple more minutes and try again. What do we have?
Are these all right? I couldn't find his
Yeah,
really
okay.
popular. So
That's okay. That's okay. Yeah, thanks. How do these work? How do these work? I don't know. Oh, I see. Wait. I see. Like that. Nah, that's not going to do the trick. That's all right. They're using needles, so that's okay. Yeah.
If we haven't got a needle,
So just stick a needle and leave it
but
there.
aren't I trying to get blood out?
No, it's okay. When you pull it out, leave it there for a few minutes, and then when you pull, yeah, it works with a needle.
I'm doing
Yeah.
a sore throat, so
Yeah,
I'm going to do like
okay.
11, is that all right?
Yeah. Yeah.
I find this wave theory really interesting. 'Cause I remember being taught at college that, the channels, the meridian has a direction. It goes
Yes.
from here
Yeah,
to
yeah.
here.
And we have right.
And you're saying it's actually a wave, and each channel has a different frequency.
Exactly.
It sort of ties in. I've recently done a course in sound therapy, and so all this sort of ties in with sound therapy.
It makes sense. Makes sense. It all makes
So
sense.
interesting.
Sorry, excuse me,
Yeah,
where the
yeah.
sharps go?
Yeah, sharps is over there. Oh, who's got the sharps? Please bring the sharps back. Sharps container back over here. So rubbish bin. We're gonna get it in a second when I get every. Make sure to switch partners so everybody can actually practice. You only have 8 more minutes for practice. So switch partners. Yeah.
Do you use the Renying Sun Cow pulses to check the channels that you're affected, or do you just go
No,
palpation?
we do channel palpation. Yeah,
rather
channel
than
palpation.
pulses?
Yeah.
When I was learning my tweener, we learned how to do all the
Yeah.
and did it that way, and then kind of just swapped out to
What's
just
that?
using channels.
Oh, it's excellent. It's good. I was just wondering, what are you using?
No, that's someone brought this, but that's not it.
Is there anywhere where the blood?
Yeah, let's put everything here, and then we'll gather it all. Yeah. We need a rubbish bin. We need
bin as well?
Yeah, because everybody's. Yeah. So use a needle. Just use a needle. Okay.
All right, well, let's see.
So we're live in the BXC. We're doing some bleeding wave.
That was really good.
Yeah?
Yeah, I could literally feel the kind of stagnation move and the area soften and it moved through.
Excellent.
But now we're swapping, and she's got a shoulder issue
Yeah.
around her bladder channel. Didn't you say though, needling arms from upper body?
No, you
No, I
can.
can still do bladder 67.
No, you need to do the hand.
I need to do
Small
the hand.
small intestine
Small
1
intestine.
and Sanjo 1
Okay.
if it's gallbladder or bladder.
Okay.
Okay?
After pricking it and
Yeah.
squeezing out the blood, and then it feels the same. Would you do anything else apart from
Well, we're going to continue in a second which needles we put in. In a minute, we'll continue with that.
But if it was gallbladder, for instance, I was doing Sanjiao, I'd
Right.
do Sanjiao.
You can,
Or
well,
was it
you
all
can palpate
gallbladder
for,
40?
yeah, you can palpate for a tender spot point and then
And then do it.
Yeah. Well, we're going to go over that in a minute.
Would it help if you don't do those? Would it
Just the
help?
bleeding, if there's a lot of stasis, helps a lot too.
And can it be a delayed reaction?
Yes, yes. No more what? So use the needle. Just put it there and leave it there. No, just leave it there. Okay.
We were just thinking.
Oh, you mean, we're not going to do the bleeding.
You on Facebook Live? Yeah?
What's that?
Is you on Facebook?
Yeah, I'm not sure if I'm going to try. We'll see. I'm going to do a live show. Yeah, let's post it. See how it goes. I've never done that.
It's quite popular.
Yeah.
I'll share it.
Has everybody switch partners? Because we have 5 more minutes before we continue. Question, yeah.
That's great.
Getting any blood out here?
What do you do if you don't get blood? And I know sometimes, because I've
Wait, which one?
some of your
Which bladder? So we don't have a lancet needle, do we? No. So let's try do it here, and if not, we'll just leave it there. Okay. Where's your pain? Okay. Okay. How much is it right now? Is it worse with any movement?
Yeah.
Which
so
one?
like
Stretching?
step and then going back.
Okay, going back. So when you go backwards, how much is it from 1 to 10? About an 8. And it's where is it exactly? Okay. So yes, sit down for a second. I'm just gonna put in the needle and see how we go. Okay. So corner of the nail right here. Okay. Put it in there. Wait for about 10 seconds. Ask her to move the back a little bit and see if there's any difference. Okay.
So take out the needle and ask it.
Oh, no, actually I would leave it there now because we don't have a lancet, so the needle's doing some work here also. So let's try. Let's see if we can get it. Be careful. Yeah, so why don't you move your back a little bit. Wait, before that.
Yeah.
Really?
Yeah?
I can go all the way back. I couldn't do that.
All right.
Okay, interesting.
Oh wow! Actually, I was trying my previous partner. I couldn't actually get. I stopped teaching qigong because I can't.
So just leave the Jingro needle there for a while, okay?
All right.
Yeah. Yep.
I just wanted to say I was here a couple of years ago
Yeah.
and I have used it so much
Oh,
since, and it's
thanks.
amazing, almost close to miraculous.
So I'm going to ask for people's responses in a minute. So if you can say a word, that'll be really
I
nice.
will do.
Yeah.
We just massaged down the channel, and
Yep.
you could feel the stagnation move down the channel, and then it literally pushed the needle out. At the
Yeah.
end. Woohoo! Incredible.
All right.
Like it.
Okay, everybody, we're going to continue with the lecture. Okay, how are we doing? Okay, are some of you feeling better? Did some of you get results? Yeah. Yeah? Okay. All right, so You're going to tell us, and if you don't mind, I'm going to film this, okay? Hold on. Yeah. All right, so, yeah, tell us what happened.
Matt, you put your news on.
I kind of had a tightness in the spleen channel.
Yep.
I felt up here.
Mm-hmm.
So obviously, bled it. Feeling a lot easier. Yeah, quickly.
And it changed quite quickly.
Did you quantify it? Did you get a number before and after? Remember, we said we need to get numbers. We want to quantify it as much as we can. So just feeling better is great, but we want to get the percentages if we can.
Okay, it was a 4 to begin with.
Okay.
Now it's probably a 1 to 0.
4 to 1. Oh, okay. Okay, good. Over there in the back?
Had a lot of pain down the bladder meridian for a very long time. So I actually stopped to go because of it. And it was an 8. I had a movement going backwards and forwards, and now I can touch my toes, and the pain is at 0.
Wonderful. Wow. Show us your extension. Okay.
I haven't done that in years.
What's that?
I haven't done that in years.
Oh, excellent. Thanks. Thanks for sharing. Anyone else wants to share? Over here? Yeah.
So today I had just a weak invasion into the gallbladder channel, and the pain was about 6, and I had restricted fluids. The pain was down to a 2, and I got about a 77% improvement in pain. But also to say that I came to this class 2 years ago, and I said to Amos that I thought it was a little piece of gold, this technique, and that has been really borne out in my practice. There's been some occasions that have been almost miraculous. One springs to mind of a lady who came, she was waiting for 9 months for an arthroscopy, and she hobbled in on 2 crutches. And I gave her the treatment, and she got up afterwards and went, "Oh, it's gone." And she walked out and left her crutches in the corner of my room. And I gave them her again 9 months later, and she'd been absolutely fine, and it just started to ache a little bit again. And I've also had a lot of success with things like cerebral palsy and plantar fasciitis. I found it quite difficult to shift the combination. So yeah, I really endorse this technique as well.
Thanks. Thanks for sharing. So,
Bleeding and then the needling, the opposite needling on either side. Yeah.
okay. All right, thanks. So, let me just finish this. So, these so-called miraculous changes, they're real, okay? They're real. Once you start practicing with us, you'll see that. And I'll show you in a minute how we actually tried to validate this or verify this in a clinical control, in randomized control study in an ER department, or you call it A&E here in the UK, right? Yeah. So basically, when you do channel based acupuncture, you're expecting results, if not instantly, then within a few minutes. And this is not just in pain management, okay? Tomorrow I'll be talking in cardiology. We'll do a demo in class, and we'll see how acupuncture affects the communication between the nervous system and the cardiovascular system, again, within minutes, okay, normally. So channel-based acupuncture is really, like, this is why, Dr. Wong passed away a month ago, and this is really sad to us, all the students that have studied with him. But the good news is that he managed to write the book with Jason. Jason and him managed to write the book and put this out there. Although, again, specifically this pain management system is not in there, but in general, the whole concept and theory of channel theory and its magic is in that book. And if you read that book, it's mind-blowing in terms of understanding of deepening your understanding of Chinese medicine. All right, so thanks for taking part of that. Yeah. Oh, yeah. Let me. Yeah. Okay. One more thing. So normally we try to do bleeding in order to resolve stasis. If we cannot do bleeding for some reason, pregnant women, children, your hospital doesn't allow, the clinic doesn't allow. Although again, I would highly suggest that you pursue and do it anywhere. But if you can't, then you can use a small needle instead, but leave the needle there throughout the whole treatment, okay? And then when you pull it out, you can try to squeeze some blood drops. And also, using alcohol swab again on the area when it's open kind of expands the blood vessels, and you can get more bleeding done, okay? Yeah. So the next thing I want to do is I want to show you guys one of the BXC is one of the great conferences of Europe. I agree. I mean, there's Rothenburg and there's UK. We have a small conference in Israel, which is really cool, and I want to show you a small film on that. We have hospital internships in Israel where you can actually participate in the conference and then do a hospital internship. And there's a short film on that I want you to see, and it's in subtitles. The English is in subtitles, but I think it's really interesting that you see what we do in Israel in terms of integration of Chinese medicine. Oh, we're not getting a... Now we're gonna...
מי שרוצה לתת טיפול מיטבי לחולים שלו צריך לעשות את זה במסגרות מערביות, עם הכלים, עם השפה, עם התרבות המערבית.
אנחנו עושים דברים מיוחדים החל מטיפול במחלקות אשפוז ועד למיון, וחלק מבתי החולים גם מבצעים דיקור בזמן ניתוחים להורדת לחץ דם למשל.
יש לנו כיום שילוב של הרפואה המשלימה במחלקות גסטרואנטרולוגיה, המטולוגיה, ילדים, כירורגית ילדים, כירורגיה כללית, טיפולי פוריות ב-IVF, מחלקת יולדות ונשים וחדרי לידה.
כל יום יש מישהו במחלקה שבא ועובר בין מטופלים שעברו ניתוח או שנמצאים מאוד מאוד כאובים, ואנחנו באים ומשלבים את הטיפול שלנו בהחלמה שלהם.
חלק ניכר מהמטופלים שקיבלו טיפול ברפואה משלימה בזמן השהות שלהם במחלקה מביעים על זה שביעות רצון מאוד גדולה כשאנחנו רואים אותם במרפאות מאוחר יותר, הם באים לביקורות אחרי הניתוחים.
אני כמטפלת גם בקליניקה פרטית לוקחת המון ממה שאני חווה פה בבית חולים, בין אם זה המגוון העצום של מטופלים שמתקבלים פה בבית חולים, למקרים השונים, למגוון של הפציעות, חבלות ובעיות כרוניות שאני רואה כל יום.
יש לנו ניסיון של 5 שנים לבוא ולעשות את זה עם מטפלים מוכשרים ביותר שפיתחו פרוטוקולים ללוות את אותם אנשים.
כל מה שאנחנו עושים בבתי החולים בארץ הוא ייחודי, והיום אנחנו לא מכירים מקומות נוספים בעולם המערבי שמבצעים אינטגרציה כזו במחלקות בתי החולים.
Acupuncture integration into the healthcare system is quite established, I should say. And like it was mentioned in the film, we actually have, in the hospital that I used to work in, we had acupuncture and cardiology and gynecology and orthopedics and delivery room, IVF, urology and neurology. So there's a chance, or you actually have a chance to experience some of that if you want to come to our conference. And the last short video I'll show you is
your clapping hands and pay attention. From the Middle East to the open nations, we coming straight to your ear, no complications. As you like come up with the summer up. Here we go, go, you better listen. The BTB train riding on a rhythm. We know they hungry, so we better feed them. Skip the bullshit and give the summer up. Pick up your clapping hands and pay attention. From the Middle East to the open nations, we coming straight to you, ain't no complications. As yella, come on, give me some, oh, give me some.
Join us Solstice, March 13 to 15. Look up ICCM conference in Israel, in Tel Aviv. It's a beautiful conference. All right, so let's continue. All right, I want to talk about distal needling, okay, and affecting the horizon. Before that, I just want to check what we have out here. Do we have? Okay, we may be able to do that. Okay, so there's an emergency room there. There's no way we can open that, right? The door over there, and find out. Can you find out if we can open that door? This it has to do something with what I'm trying to say here. So, talk about distal needling. So imagine we have this classroom right here, okay, and it's a smaller class than this one, and it fills up with people, and we're all in this room, and all of a sudden, what happens after like 10, 15, 20 minutes? The air gets stuffy, right? So normally we either turn on the air conditioning in the modern era, or a fan, but that sometimes just steers the evil chi locally, okay? Another approach would be to open a window here, okay? Right here. Okay, and open, let me see if I can get this down. Yeah, open a door. No, I know I lost it. Okay, it's that. Do it again. Okay, so one approach would be to open a window on one side. You can see that blue on the window on one side and a door on the other side. Normally what happens is naturally the flow of air goes through the affected area. Now we can try this. If we had a chance to open the other door, we can see that. If you can, that's fine. If not, maybe just open that. Can you open that and leave it open? Maybe we'll see that in a couple of minutes, okay? If we just had a chance to open the back door, you'd see that instantly. And the whole idea is that when you do local needling, okay, in a congested area, in a compromised area, often what you're doing is you're steering the obstruction, okay? There's inflammation there, there's edema there, there's sometimes like the inflammatory soup going on, and the whole concept would be to clear it away first before you want to steer it in. So the concept is, remember, I'm saying acupuncture is about suggestions to the human body. We're suggesting, try to move things from this area to that area, and you're making a suggestion, why don't we clear the obstruction? So we're thinking, in terms of chi, we're thinking of moving chi through the compromised area to rejuvenate the flow, rather than to the compromised area. When you do a lot of local needling, you're bringing a lot of attention. Remember, acupuncture is about suggestions, and you're bringing a lot of attention to the area, and if it's still obstructed, then you may actually either aggravate or get less response. So by bleeding this Jing Well point and clearing the channel, And then with needles moving qi through that by creating this wave resonance of qi, then you're actually getting this effect of rejuvenating the damaged tissue by moving fresh qi of the system through the area, clearing the obstruction. Okay. It's okay. So remember, we were saying actually we want to keep it open for. Yeah, we want to keep it open. Just 5 minutes and then we'll close it. Okay. Yeah. Where was I? By doing this distal needling, we're rejuvenating the flow. Remember, I was showing before, when you have obstruction, it's not just the pain. The obstruction means that there's compromised flow of fresh qi to the area that is blocked, okay? So by doing this initiation of a wave by bleeding, and then following up on distal needling, we're rejuvenating the flow of qi. Not only that, when you, and you're also, in a way you're trying to achieve kind of like a whip-like effect. Okay, and a whip is very strong. A very small motion on one side creates a very big action at the other end. Right. This is what we're trying to do in terms of the needling. Another thing is, there's two theories about channel flow in the body. One is the sequential flow of qi, lung, large intestine, stomach, spleen, heart, small intestine, bladder, kidneys. And one is the 5 shoe theory, okay? We don't have time to go too much into that, but in general, you have to understand that there's channel flow, okay? Channel flow, this wave resonance that we're talking about, okay? And the whole idea is to activate as much of the channel qi in that channel to get this flow going, okay? So if you have an injury, say here, on the medial menisci, okay, around liver channel, and if you just needle locally with these 2 points right here, okay, then in terms of channel qi, you're only activating a very small portion of the channel qi, okay? On the other hand, if you are bleeding, the last point on that channel, in this case it's liver 1, okay? And then if you use one needle here, like let's say PC7 or PC6, and leave liver 3 here, what you're getting is you're getting activation of all this Jue Yin channel qi. So your leverage is on the channel is way stronger, okay? So by doing this, we're achieving 2 things. We're bleeding a Jingwell point, indicating the direction of flow, okay? We're needling 2 points, distal points, which cover the compromised area, rather than selecting a point here which doesn't cover it. Here's a point that covers. And we're creating this wave which works like a whip, which activates the channel vigorously and achieves this immediate effect. Okay?
So, sorry, you bleed on the same channel and then you needle it?
Different point. Yeah. In this case, this can be liver 1, this can be liver 1, liver 3, and PC6 or 7, for example. Okay, bleeding on the Jingwell and the needles on the 2 other points. Okay, for example. Okay? So this is why you're getting such a strong response. Okay? Exactly. Of course. Okay. Point selection is actually achieved by point function according to the blockage in the channel. So if you have heat in channel, you want to heat clearing points. If you have dampness in the channel, damp clearing points. Okay. And if you can't find a distinction, you do channel palpation. Okay. Yeah. So going back to this resonance theory and channel pairing, the wave resonance beats throughout the whole meridian pathway. So you need each channel to good wave propagation. So if we did bleeding before, the bleeding was like initiating a wave, then the needles actually propagate the wave flow and create even further enhancement. And you will see the difference like we had with, what's your name again? It's Clara? What's your name again? Yeah, Kate. So with Kate, we were bleeding the LI1 Young Ming point, okay? And we didn't see a huge difference just there, indicating that, how long have you had this? 2 weeks, okay, I'll explain. So it's a new condition. So there's not a lot of blood stasis there, okay? So we didn't get a huge difference in terms of the bleeding, but then when we used the wave, the LI and the stomach, then we got the 50% reduction, okay? So the longer you have stasis in the channel, the more profound your results are going to be with the bleeding, okay? Again, we do both things, but you can actually assess how much stasis there and how much blood stasis there is there and how much chi stagnation according to what kind of an effect you're getting. And again, being meticulous about record keeping and about quantifying the limitation is key here, okay? And the reason is, what you see often is that you see that these pains start switching channels, okay, and they start moving around. And this is really important. This is actually a good sign. So they had shoulder pain right here on Yang Ming. This one's gone, but I have pain now here. This can happen throughout that same treatment or through the treatment series. So I say, well, this has been reduced, but I have pain here now. This is actually a great sign, okay? So you follow to the next channel. Normally you do one more treatment here just to consolidate the effect in this channel and then switch to the next channels. Sometimes we do 2 channels at the same time, okay? So, and that's one thing. The other reason to quantify is because you really want to assess how much progress you're getting. And you will get a lot of progress, and then you start getting into these plateau areas where you have, it feels like you've made a lot of progress, but then there's still pain there or limitation there, and you can't make any more progress. And you need to realize that, because there's certain maneuvers that you can do of readjusting the channel to get over that next step. So that's another reason to do quantification. Another reason to do exact quantification is that patients, and even the practitioners, often forget you're in the 6th treatment now, okay, and you're not sure. So your patient comes in and you ask them, how are you doing? And they say, I still have pain. That's a very common response. I still have pain, okay? So you go back to your chart and you say in the first treatment, they couldn't do it more than 45 degrees. Right? Now they're already 90 degrees. Yeah, they still have pain. They had 7, now they have. So you need to really make sure that you quantify the limitation. This is true for anything, and this is true for whatever you treat. I think quantifying the limitation is really a key for your case management through a treatment series. It's really important, okay? And the more objective you are, okay, the more true to it you are with yourself and with your patient, down the road is going to be much more beneficial for both of you. You'll see that, okay? Okay. So, short recap. When blood is stagnant, I wouldn't say qi wouldn't move it. It's more difficult to move blood stasis with just qi. So you want to move the blood with blood. So the action would be to bleed the Jingwell point to remove the stagnancy and to initiate a wave. And then since each channel has a specific energetic or wave resonance and quality, you tap into the correct resonance by identifying the correct channel and by activating the whole channel and by selecting points according to your TCM knowledge. And you actually create this wave propagation. And normally you should be assessing for an immediate effect. So we have this wave initiation, wave propagation, and wave effect, okay? So during the treatment, we actually assess repeatedly how much progress we've made. What's done more? Is it more the bleeding? Is it more the wave? Is it more the other points that maybe we've selected a wrong point, or maybe you can select a better point. The treatment should be very active, okay, for the first 10 minutes. After that, you leave the room and let the patient relax for another 25 or 20 minutes. But the first phase of your treatment should be very active and reactive. You should get this input of how much progress you're making. Okay, so why is this so effective? Well, one is if you're very accurate with your channel identification, then your message to the body is very clear. Remember, again, acupuncture is all about delivering suggestive messages. That's how I see it. I mean, what are we doing? I tell this to patients as well. There's nothing in the needle. There's no stuff in the needle. It's just a suggestion to your healing. Acupuncture is about facilitating a healing response. Okay? It's about enhancing the body's own ability to recover. Okay? It's about removing obstructions so the healing system can actually kick back in and do what it knows how to do. Okay? Because often what we have with chronic problem is that it's been there for so long and it's been stuck there for so long that the body's healing system is kind of given up on it. Okay? And by establishing this connection and this suggestive message of directions, try moving this way, try moving that way. Okay, let's see if this works. That's the beauty of acupuncture. Okay, and that's also the safety of acupuncture. Acupuncture, for instance, is very safe because you're making these suggestions, and if they're very wrong, normally it's not that you can't do damage, but you can. But acupuncture is very forgiving. Okay, compared to herbal medicine, for instance, where you actually bring substances into the body. Okay, so the beauty of acupuncture is about this discussion and this suggestions that you make in order to do some realignments, in order to redirect chi and blood and flow and energy and again, all in order to facilitate and awaken and enhance the own ability of the body to heal itself. Okay? The second reason this is so important is because Jingwell points are damn strong points. I can't say it any other way. Jingwell points are strong points. Okay? These are points of the exchange from yang to yin plane, right? From the yin to the yang plane. We talked about that in the beginning of the class. Everything is about yin and yang and the potential differences between yang and yin, the potential of things to happen between heaven and earth, between yang and yin. Everything starts on this yin and yang plane. So this is exactly where those Jingwell points are located. Okay? Apart from the fact that we know from the classics that they activate the TMM and they reduce obstruction and they strongly move blood, but they're also like the initiation point of chi flow according to the 5 Shu theory, right? So these are very strong points. Okay. The next reason, again, is that whip-like wave resonance effect that you're actually activating in the whole channel by using these distal points, leveraging whole channel chi. Okay. Another thing, I don't know, some of you who've done that, I've asked them to move around during the needling or during okay. So when you don't do local needles, you can actually activate the compromised area during a treatment, and that's further enhances the flow of chi through the area. Okay, so that's another reason. And again, because we're trying to be very accurate and because we're repeatedly assessing the effect, we pursue results. Okay, so when you pursue results and you think that, and if you're not getting results, you're changing something. When you pursue results, you will eventually get results because this is based on theory that you all know and understand and have experience with. So we'll come back to that. I'm going to show you a little bit about what we did in the ER study. Some of you may have seen this in previous lectures that I gave. Basically, we wanted to show, this is after using this protocol for almost 10 years in our outpatient integrative medicine clinic. We said, okay, this is time to do validation. Okay, time for validation. I do have water here. So we compiled the clinical study in the A&E in order to see if this system can actually work for acute pain as well. And we actually, we knew it worked for acute pains, but we never knew if it really worked for acute pain as severe as the ones that get into the A&E. But the idea was to do a randomized control study, and we had 3 groups. all receiving standard care in the ER or A&E, all receiving medication. And then one group received no treatment, which was just lying down for 25 minutes. The next group received a placebo sham mock stimulation, which we compiled by, we only recruited patients that have never had acupuncture before, so they didn't know what they were expecting, or what they were expected to feel. So the patient would lie on the side, and the practitioner would come in front of them and open a needle bag, show them the needle, go behind them, chuck the needles away, pull out the empty plastic guide tube, look for Asha's source point, and just tape the plastic tube there. Connect an electrical stimulator to the plastic guide tube, bring the stimulator in front of the patient, turn it on, not really, but it was beeping and making these sounds and it had lights on, and ask the patient, do you feel this? And increase the volume, and they would say, oh yeah, now I feel it. So it's amazing how, the placebo effect is amazing, So that was the placebo. And then real acupuncture was meridian wave acupuncture to the system. And you can see the results. The medications reduced on a scale of 1 to 5. So we had like 14 to 16 percent reduction with the medication, and another 6.8% with the no acupuncture, 8.3% placebo, and then 25% or 26% with real acupuncture, making the cumulative effect of drugs plus acupuncture to close to 40% reduction, which is unprecedented in the ER. So they were really blown away with this. And we've also seen, these are the actual pain scores of the three groups. You can see the real acupuncture group in the middle goes down from 8 to 3.9, more than 50% reduction for the mean group change. And also in terms of spinal flexion, we saw an increase to close to 60% compared to the other groups with this combination of therapy. And if you want to read more about this, you can look this up. Again, someone was asking about the email list, because it will. Do you know where it is? Has anybody? This is an email list for sending you the slides, so you can actually take a look at this. Are we done with this? We're done. Okay. I'll bring it down over there. So you'll have that slide also. You can look up this study. Oh, you'll find a. Okay, so the most important thing, though, for us was because of the results of this study, we actually had paid acupuncture as staff member in the A&E for like 7 to 8 shifts during the week. Like the busy shifts. So that was a big change in the hospital. And again, this is what we aimed for. The idea was practical research. We knew that if we could get the study to get good results, we can actually convince the management of the hospital to have an acupuncture on staff, which is what we were kind of aiming for. All right, so tomorrow I'll talk about cardiology, but I just want to show you a couple of slides if you miss my lecture tomorrow. So how amazing is acupuncture for cardiovascular disorders? And again, tomorrow we'll do a demo as well. So, I'll start from the end. Acupuncture for arrhythmia is great, It works great. Not all cardiovascular disorders work as well as arrhythmias, but arrhythmias, again, and I must say non-life-threatening arrhythmias, it's a good, we never deal with emergency states. But there's so many of those non-life-threatening arrhythmias which actually affect people's lives. So acupuncture works really well. I just want to show you a couple of examples. So this is AFib, atrial fibrillation, where the atria is actually fibrillating at about 300 to 400 times a minute, but the ventricles are actually keeping the normal rhythm, although what happens is it increases. So you can see the heart rate here is 112. You can see it's irregular. And those of you who know a little bit of ECG see that there are no P waves here, This is a patient with 8 hours of atrial fibrillation before treatment the time is 10:38, okay? At 11:38, an hour afterwards, we have, during the treatment, we have what is called cardioversion. Cardioversion is where when atrial fibrillation converts, okay, to normal sinus rhythm. You're seeing the heart rate is 62. It's regular. There still are a couple of premature heartbeats here and here, okay, and here, okay? But the rhythm is sinus rhythm. This is normal rhythm with premature beats, okay? And then the same patient, after another 20 minutes, we're getting the sinus rhythm, okay? This is acute cardioversion. Patients that have atrial fibrillation that does not go away would go to the hospital to get medication or even electrical shock to change that sometimes. Okay. So now, does acupuncture do, what's the success rate with cardioversion? It's not very high. Okay. It's 30, from our experience, it's like 30 to 40%. It's still a lot. It's still amazing. It's only to show you the magnitude of effect that acupuncture can achieve. Okay? This is a patient with multiple premature heartbeats. Okay? These are ventricular premature heartbeats. This patient has every second beat as a premature heartbeat. Those big ones circled in the red should not be there. The small ones are the normal. These are normal beats. Okay? So this patient is here at 12:45, okay? And then this is 1:15, okay? So 30 minutes afterwards, those VPCs are completely gone, okay? Now, normally what we do is we have them, we do an ECG, we have them lie down for 25 minutes, we do another ECG to see if it's not just from lying down, and then we do the treatment and we check them again, okay? So, now, does it stay like this? Not initially, okay? They come back the week afterwards, they still have VPBs, but they have less than they had before. You do another treatment, it reduces more. You do another treatment, and then you have this accumulative effect when they have like, the VPCs are actually reducing from week to week, okay? And the gold standard for assessing that would be a 24-hour ECG or a Holter, okay? And you can see here at the top, that patient had 10,553 VPCs in the 24-hour ECG before starting the treatment series. And then after 12 treatments, 24-hour, you have 0, okay? And this can stay stable if you do maintenance treatments on these, okay? So acupuncture really, really works well for these kind of arrhythmias. And again, if you want to learn more, you can come tomorrow. Okay. This is another patient. You can see atrial premature complexes 7,000 before, and ventricular premature complexes 4,000 before, and then I don't know how many treatments. I think it was 10 treatments. This is non-seen after. Okay. So acupuncture for arrhythmia is really interesting. And just to tell you that if you do something as simple as PC6, stomach 36, liver 3, you're actually reducing the risk of developing several cardiovascular disorders. And there's a way to measure that. And again, I'll talk about that tomorrow. Okay? So acupuncture really has a strong effect on the communication of the nervous system and the cardiovascular system, and again, in a quantified manner. Again, tomorrow we'll talk about heart rate variability and how you can actually immediately see if your treatment is actually doing what you want it to do. So what I want to do now is I want to do another demonstration, but I want to do like a whole, because there are a couple of other people that we talked before. Does anybody have pain and was not treated yet? Yeah, okay. That's one. So you didn't get a treatment? No. Okay. So remind me what your pain is? Hip pain? Yeah. Hip pain. Okay. And how long have you had it?
Oh, 20 years.
20 years. And it's a degenerative disorder, or is it more trauma? No, but how did it start?
I always stress. I put my leg
so it was sudden.
No, it was trapped. Something's trapped in there.
Okay, okay. And do you have any limitation? No, just pain.
Just discomfort. I can
Discomfort. Do you have it right now?
It's there all the time.
How much from 1 to 10?
I've had it for over 20 years.
No, how much pain? 10 is the worst pain and 0 is no pain. Right now, how much pain would you say you have?
Say
2. Okay, all right. And can you show us where it is? So what channel is that on? Is it bladder or gallbladder? What do you think?
Shall we choose between?
Mixed, huh? So what do you do if you have like a mixed condition, right? Mm-hmm. That's a question, right? So normally we try to be very accurate. So I would try to suggest or to find out which one of the two channels is more compromised and start with that one. Okay? If it's dead center between two channels, we can do 2 channels. Okay? Which is probably what we'll do. But so can we do a treatment for you? Yeah? Maybe we can do the sitting. If can you sit up here? Oh, I'm out of lancets though.
Oh, yes.
Oh, okay. What's that? Hey, Alex, thanks for that. One refuge. Thanks. So I'm going to ask you a couple of questions. So if you could describe to us the type of discomfort. Is it more sharp? Is it more dull? Is it more achy? Is it more
achy, like something
achy? And when is it worse? Is it worse in the morning, in the evening, at night? No difference? No difference?
No.
None at all? Okay.
Only unless I walk too long.
So after walking, it's worse?
If it's a lot of walking.
If it's a lot of walking, then it's worse.
If it's a lot of exertion.
So normally at the end of the day, it would be worse after exertion?
No, sometimes I wake up.
Sometimes you wake up in the morning. Okay. So we're getting some hints here about what kind of pain this is. Okay. We're having a mixed excess and deficiency. Why? Long-term exertion makes it worse, but on the other hand, also in the morning. So why are pains worse in the morning? Yeah, because of stagnation, because we haven't moved all night. Okay. Okay. So we got a mixed condition here, and we have to decide what we do. So, and let me ask you a couple other questions. When you take a shower, is warm water in that area, does it feel nice? Not in terms of relieving pain, but does it feel good to have warmth there, or would you dislike that?
It doesn't make no difference.
It doesn't change the pain, but does it make it worse?
No.
Does it feel okay? Not in terms of reducing pain, but does it feel good or no difference?
No difference.
No difference. No. Okay. And one last thing. Is it just pain or limitation, or do you sometimes feel anything else, like weakness in the leg? Or
it does feel weak.
Sometimes.
When it's bad.
When it's bad, so you feel the leg is a little bit. The whole. Okay.
drag.
So I would guess, just from the story so far, that there's more deficiency here than excess. Also, because the story is, CCC has this for 20 years, right? So 20 years long-term stagnancy, the tissue to that area, the tissue clearance is compromised. So we're thinking there's also definitely some deficiency, and the story kind of verifies that well. So in terms of the needling that we would like to do, we would like to address also the deficiency, not just removing stagnancy. Okay. Are there any other questions you would ask? What's your name?
Lim.
Lim. You would ask Lim? Go ahead, ask.
Does cold make it worse?
Make no difference.
Cold weather or damp?
Okay.
No difference.
Makes no difference, but a great question, right? Does cold make it worse? Okay, wonderful question. Yeah, do you have a question? Since it was a dull ache. Yeah. Yeah. So if you're going to ask a question, you have to tell us your name, though. Dan? D. Your name? What's that? Joe. Yeah.
Oh, only when it's very bad. You'll go down a little bit down the leg. That side? Down more like mid-thigh, but mainly it's fixed.
So when the pain does radiate down, can you show us where it radiates?
It doesn't go much. It just go down maybe up to here.
Okay.
But nothing much more. And then
Okay.
it just
So mid-thigh, but side and back of the thigh, right? It doesn't cross to the...
no groin,
Okay.
no.
Okay. The reason I'm asking this is because often, in this case, it sounds like it comes, and she says, the hip area. But when you have back pain, especially if you have ruptured disc and you have bulging discs, and they're really severe, you have actually pain sometimes that radiate to the thigh and actually all the way to the groin. And then you ask yourself, okay, we know it's a back pain that originates from a bulging disc, meaning it's either on the Dumai or on the Taiyang, but I have pain here on the Drayan channel, so what do I do, right? So what do you treat? And the answer is you do a root and branch treatment, just like in Chinese medicine. So you treat the root by addressing the Dumai or the Taiyang, but you also need to follow that channel. And the reason we have this radiation to a certain area is very simple. I'll do that by asking you a question. So let's say you have a patient that you've diagnosed with liver qi stagnation rising up in the Shaoyang. So she has migraine. She comes in for migraine headaches, okay? Left-sided pain, excruciating pain, once every 2 months, really bad. And then you've been treating her, it's like 3 or 4 or 5 treatments, you're making good progress. And then one day she comes back to the clinic and she tells you, listen, I lifted something and as I lifted it, I sprained my back. And it radiates down, the pain is radiating down. So I would ask you, where would you guess the pain radiation would be? On which channel? On the gallbladder channel, because that's a compromised channel to begin with. Okay, this is very common. We see that very often. So she made a movement, she sprained her back, it radiates down the compromised channel, because that's how energy does. Okay, it's a deficient channel, it's been there for a while, there's a problem there, the excess goes where it can go. Okay, so this is very common to see these kind of combinations. So you need to kind of look into that. Okay, so right now when you just sit here, do you still have that discomfort? Okay, stubborn, huh? Yeah, very stubborn.
Yeah.
Question, Alex?
Is there any pins and needles?
No pins and needles, but sometimes it feels like it's numbing. Yeah.
Okay. Okay, so numbness. What's the difference between numbness and pins and needles? Numbness is lack of sensation, pins and needles. Okay, I see. Okay, so in general, are you pretty healthy? Do you have any other conditions going on?
I got a heart murmur, dysfunction.
Heart murmur, okay.
Yeah. I've got, I'm on thyroxine because
Okay.
of the thyroidectomy.
So thyroidectomy, okay. So,
That's it.
okay. And do you have a irregular rhythm with
Yes,
the?
I have got palpitation.
Is it constant or every
No,
once in a
on and
while? Okay. Okay.
Usually at rest.
Do you feel them when you have them?
Yes.
You don't have them right now.
No.
Very slow. You actually do have them right now. We can actually do a mixed cardiovascular and an orthopedic demo maybe tonight. But in order to verify this, here's what we'll do. Can you get me? No, I have water. I have tissue. I'm fine. You know what? I'm just going to have you hold something in your hands.
Yeah.
Okay? This is just water. I'm just going to wet your two of your fingers like here. Okay? And I'm just going to put this on your knees here, on your... Can you hold this like that?
Yeah.
Okay, just leave it there. Don't press too hard on it, just kind of touch the middle gently. Okay? So try not to move, try not to move. So you see how slow her pulse is? Okay, and And can you see irregularities? Not yet. We'll see in a second. I thought I felt the skipping beat, but we'll see in a second. I'm going to do this again, okay? So we're getting a pulse which is around 50 or less even. I'll see in a second. 47, right? Okay. Wait, don't talk. You can't talk. Sorry, I didn't say. Because it changes the reading a little bit. Okay. Yes, the pulse is around 50, which is a very slow pulse. Okay. So we're having a picture of. Are you more cold or more hot in general?
I don't like the cold.
You don't like the cold, right?
Or wet.
Okay. Yeah. So. Okay. It actually, the system has just picked up arrhythmia. Can you see the red? So there was a skipping beat there. She doesn't always get. They're not very frequent, but we just. I thought I felt that, so we were seeing that. Okay, that's all right. Thanks. So what are we beginning to get in terms of a Chinese medical diagnostics here? Let me repeat a couple of that. Long-term injury to the hip back area, okay? Tai-yang channel, thyroxine, cold sensations, slow pulse. What are you seeing so far? Just from the story. Huh? Yeah. Okay. So the next thing would be to ask questions regarding that. Okay. So what questions could you ask?
No. How long have you been on thyroxine?
After my thyroid, about 8 years ago, yeah, I was hyper. I had the cardiac murmur when I was young. You what?
How long will you have
Thyroid problem was about uncontrolled for about 2.5 years. I had to have the thyroidectomy because I was having multiple cardiac problems.
What other cardiac problems did you have?
With the when was hyperthyroid.
With the hyperthyroid, you had arrhythmia.
I was very bad.
Mm-hmm.
I was very bad.
Okay.
I was having cardiac murmur.
Okay. Arrhythmias, probably, she means, yeah.
Yeah.
So, okay, can someone explain what's going on in terms of the picture, okay? What do we have here as a root cause? You're saying kidney deficiency, yang deficiency. How does that relate to the heart at all? Does it? Kidney yang not supporting the heart yang, right? Mingmen fire deficient, not supporting heart fire. This is very obvious. Slow pulse, arrhythmia. Started with problems with thyroid problem, which has to do with sanja, which has to do with kidneys again. Okay. Remember, yuanqi starts at the kidneys, flows through the triple warmer, throughout the whole body. So this connection of metabolism and Xiao Yang and Xiao Yin, the kidneys. Okay, so already from the story, we're making all these connections, right? And we haven't even taken a pulse on the tongue yet. Let's see if they verify what we're thinking. Okay. So I'll take your pulse again. The pulse is deep. Any medications that you're taking apart from thyroid?
That's all I take.
That's all you're taking. So this is important to ask, because if you say it's just a slow pulse, you want to ask if she's taking any beta blockers or any other medications to reduce the pulse, right? So it's a deep pulse, and it is deep and weak in the left churma in the kidney position. Okay. Can we see your tongue? Okay. What do you see with the tongue? Color. Yeah, a little bit pale tongue. Okay. The liver pulse is actually okay. The root is okay. little bit of deficiency in the sunma, in the heart position. What about complexion?
I got leukoderma.
You have to ask, right?
So I got no color
Right.
at all.
So this is not just pale, okay?
The hair is from leukoderma.
Mm-hmm. Yeah, actually, the middle GI pulse is. How's your digestion?
I used to have stomach problems, but I've been pretty good.
Pretty
since,
good?
Yeah.
Yeah, stomach chi is actually pretty good.
Yeah.
Again, what we're seeing mainly on the right side as well is the kidney position, which is weak, deep, and it's actually tight when you go all the way down. Like this trapped coldness there in the channels after a while. Okay, so can you take the sandals off? Okay. All right. So we don't have anything for you just to lie on, right? No towels or anything like that.
To lie.
You can use that. You're not going to be too cold. Yeah. Okay. Yeah, if you can use that.
On my back? Or?
Yeah, on your back. So, so we can do bleeding. Unfortunately, I don't have any gloves left, so I'll have to do this barehanded. I'm sure it is. I know it is. Can you show us for the last time where the pain is? Oh, thank you.
It's all here.
Oh, yeah. Okay.
Here.
And do you have it even when you lie down now?
Oh, yes.
Yeah?
Oh, yeah.
Okay. Stubborn pain. Okay. I would guess there's blood stasis, cold, and kidney deficiency together here, making this a very stubborn pain that's always there. And it's a challenge. Let's see if we're up to this challenge. It's definitely a challenge. She may need some warming up in terms of the treatments before we see results, but we'll see. If there's a lot of stasis there, we'll be expecting a change. Okay. So I'm actually going to do two channels, Shaoyang and Taiyang, because I can use warming on both of these. Both of these channels have to do with warming. Taiyang to the surface, Shaoyang because it brings heat. Okay, through the triple warmer. And I would probably do a shorter treatment, maybe 15, 20 minutes. Yeah. What's that?
I woke up with a
neck pain? Shoulder pain also.
Yeah.
Maybe you can help me with that.
Last night.
Can you, and her feet are very cold. Can you exhale for me? And again. Thank you. Is this painful?
No, it's all right.
It's very difficult to get blood because the feet are very cold. But again, when you do the bleeding, don't press too hard. Actually press gently and wait, because when you press too hard, sometimes it just blocks the flow, okay? So I'm going to ask you to bend your knee and hold it like that, and then hold it with the hand like this and stretch it a little bit, just a little bit. Okay, is that too bad?
No, that's fine.
Okay, and now release it, and now bend your knee again, and then tilt it towards me a little bit till you get a little bit of a stretch. Are you getting a bit of a stretch or not yet?
Yeah.
Okay. And now I'm going to release it and bring your foot down. Okay, and tell us if there's any change at all. Or not yet.
Still there.
Hmm? Still there and still a 2?
Less, a little bit less.
A bit less? So less is what? 1 3/4, 1 1/2, 1?
Half what it was.
1:30. Okay.
50%.
50%. Okay. So wait, it's a 1 or a 1 1/2?
1.
Oh, it's a 1. Okay. So we have a reduction from 2 to 1, which is 50%. Of course, it was more dramatic if it was 10 to 5, but it's still 50%. Okay. And now I'm just going to do some warming points. Okay. So I think we discussed before source points. I have these really short needles here that I normally don't use, but okay, I don't know. You got some longer needles? Thanks. Ooh, these are really long needles. Okay, thanks. Okay, we'll see. See how we do. I'm going to use bladder. Okay, so I'm thinking of bladder 64. I'm not sure, so I'm going to palpate. Is there a difference between this point and this point? Ooh. Bladder 64, right? And I was pressing same pressure, okay? So there's coldness in the channel, okay? So exhale. Can you feel this?
Yeah.
Okay. Now, is there a difference between this and this? Or is it pretty much the same?
Ooh, that's so.
64. Smaller than 4. Okay? Again, channels don't lie. They're okay. Can you feel this? Or not so much?
I can feel it now. Yeah.
You feel it? Smaller than 4. Now, can you feel both of them at the same time?
Yes, I can.
No, we lost this one.
Oops.
Yep, strong. All right, try to bend it again. Bend your knee again, stretch it. Release it. Any more change or exactly the same?
There's nothing there now.
No pain?
Just a little bit.
Just a little bit. So maybe a half.
Yeah.
Maybe a half.
Yeah.
Okay. So we're just gonna keep it on Taiyang, okay? If we had more time, we would also do treatment for your heart because we can help your arrhythmia, I think, as well. But
I think I was born with it.
yeah, but still, you can reduce the amount. In general, we would do a Shao Yin, probably on the opposite side, maybe a heart 7 here and a kidney 7 on the opposite side, or a kidney 3 and a heart 7 against source points, again to benefit and tonify. Yeah, definitely for her. Yeah. So why don't you enjoy the needles a couple more minutes, and we will wrap it up. So, any last minute questions before we? Yeah, Alex is asking a question. I normally use Moxa towards the last phase of the treatment series for warming and bringing chi to the area. So I hope you enjoyed it. Oh, any questions? Yeah? So I would try to look on the pathway for that channel. Okay? Yep. For her, I would do 15 to 20 minutes, not more, because she's. How many treatments? 8 to 12. Should do enough. It should be enough. Yeah, sometimes yeah. In the outpatient clinics we do. Yeah. Thank you so much for coming. You have this in your class brochure. Please come join us in 6 weeks in London. You can teach you the whole thing, so you can use it. All right? And thanks again.